have another recovery session for you today. This one is on calf pain, tightness, soreness, anything that's going on in your calves. I'm Steph. I'm a physical therapist. I am an online run coach. I have a passion and love for helping especially beginner runners or beginner again runners get into running, learn to love it, learn to get faster without getting hurt. So that is why I'm here. If you're catching the replay, please comment replay. I'm also going to disclaimer that this is not medical advice. This is not a way to diagnose anything or anything like that. And it should not replace any treatment plan that you have in place from a physical therapist or a medical provider. But it's a way to help your body recover from all the damage you're doing, essentially, because when we're running, when we're lifting weights, when we're cross training, we're doing all these things, we are creating a little bit of damage to our tissues, but that's how they grow. So if we can help them recover faster and help the tissue regenerate, then it just makes us stronger and able to perform better and more efficiently. So we're going with the calf today, and some of these are going to be similar to the shin pain one, but obviously they are connected. So we're going to do a few similar ones and then a few different ones. I actually love dealing with calf pain because I learned this fancy trick. It's not fancy, but I learned this trick in a course that I took, and I really love it. It's worked really well for me, so I'm excited to share that with you, but not yet. So we're going to start with our tennis ball, and again, all you need is a tennis ball, foam roll, and some kind of strap, belt, towel, scarf, something like that. This is a yoga belt that I'm going to use today. So we're going to start with our piriformis. So I'm going to kind of sit on this tennis ball a little bit and cross one foot over the other a bit. And the reason we add in some hip openers, hip massage techniques is because if we've got tightness there that's limiting the movement of our legs during our like cycling, like our gait pattern of our legs when we run, that can cause some problems down the chain. So if your hips can't move and open, I'm going to switch sides, then you may end up putting more strain on your calves than you would have otherwise. So that is why we are doing some hip release as well. And again, I would do both sides. I would kind of pay attention to if one side is more sore than the other. Like for myself, this side is more sore. So maybe spend a little bit more time on that one if you have it. But if you're not really feeling a whole lot of like soreness or tightness, then you don't need to spend a ton of time. So we're going to switch to arch rolling. So again, you can do this with a tennis ball. I again have my rubs ball. It's RUBZ that I really like. It's a little more dense, and it's got these little pricklies on it that just give a little bit more massage. So that's what I like to use for my foot. So we're just going to roll through the arch. Find any areas that are sore or feel kind of knotted and try and stay on those a little bit. I'm just going to rock over this knot in the middle of my arch. Switch sides. So I kind of go over the whole thing first, back and forth, and then find that kind of sore spot, knotted spot, and kind of rock over that. Okay, then we are going to do one more with the tennis ball, but I'm going to come back to it because I want to foam roll first. So we're going to grab our foam roll. I'm going to do my shins first. So either one or both It's kind of hard for me to do both at the same time, so I like to do just one, kind of rolling up and down on the outside of that shin. Again, this is connected to the calf, so it's important to keep both of them loose and help them recover. Switch sides. If I wanted more pressure, I could be like rolling on it, but this is sufficient for me right now. Okay, then we're going to switch to the calves. And I'm going to start with both. Turn a little bit. Start rolling both my calves here. Rotating them in and out, so I make sure I get all parts of the muscle. Okay, I'm going to switch to one. Get a little deeper. Switch sides. This is pretty uncomfortable because I haven't done it in a little while, and so it doesn't feel very good, but I know it will later. Okay. Now, I'm going to grab my ball. I'm going to go back to this. If I had two tennis balls, you can do it this way. So I'm going to put one underneath my calf, and I'm just going to lay it there, and then I'm going to roll this one on top. If you don't have two, that's fine. You can either put your fist underneath to kind of push up that muscle belly and then roll the ball on top, or vice versa, but it's kind of easier to have the ball on top to roll. So the reasoning for this is the calf muscle, the big gastrocnemius muscle, is almost like three-dimensional. I mean, all of our muscles are three-dimensional, obviously, but rolling, you're only getting, you know, like one plane. But this muscle really has two heads on either side, and knots can hide up in those that you can't really get with stretching, you can't really get with a foam roll. But an instructor in a class taught me this technique, which has been so helpful, not only for myself, but also for a lot of patients and other runners that I've worked with. Because, especially on the inside of the calf, I have found, gets really tight and sore and knotted. And it not only can cause problems in the calf, it can cause problems at the Achilles, and even like plantar fascia symptoms down at the foot. So you will probably find, if you do this, that there are some definite knots and sore areas in your calves right here, as I feel right now. And it should give you some relief to work on them. All right, so I'm going to switch sides, and then we're going to go to the strap and use some, and do some stretches, isolated stretches. And this one's more sore. Move this ball down a little bit. So again, if it's more sore, take a little extra time. Whew, that doesn't feel very good. Again, I haven't done this in a while, so it's very much needed, obviously. All right, let's grab the strap, and then I'm going to lay on my back. Put that on my foot. I want it on my forefoot there. Okay, and what I'm gonna do, leg pretty much straight, I'm going to actively pull my foot up and then a little bit extra with the strap for 2 seconds and release. Pull, strap, 2, release. So I'm going to do that 10 times. That was 3, 4, 5, 6, 7, 8, 9, 10. Switch sides. For 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, then we're going to move to the soleus, so this lower calf muscle. I'm going to do it in a seated position. All I'm going to do is pull my foot up, pull up with my hands a little more, 2 seconds, and release. So there's 1, 2, 3, I'm feeling that down through here, 4, 5, 6, 7, 8, 9, 10, and switch sides. I have one more after this. There's 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, last one is for the hip flexor. So I'm going to begin tall kneeling, 1 foot back, 1 foot forward. I'm going to have my hands, so I'm rotated this way just a hair. And what I'm going to do is just kind of tighten my tummy. So I've got my back flat, so I make sure I'm feeling this through the front of the thigh on this side. And I'm just going to lunge, 2 seconds, release. Forward, 2 seconds, release. 3, 4, 5, 6, 7, 8, 9, 10. I'm trying to go a little farther each time if I can. Switch, rotated just a hair. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, that is your recovery session for calf pain. If you try it, you like it, it works, please comment and let me know. I'd love to know if it's helping somebody else besides myself and the people that I work with in the clinic. So let me know, and everybody have a great day. Happy running.